Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain that you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. To speak with Dr. Darrow, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. Why are you so gorgeous today?
It's my nature.
You were born natural.
Well, I eat a lot of chocolate. I do a lot of dancing. I live well.
I think that's the answer. So what are we going to do today, Nita?
We're going to teach people how to make better choices for their degenerative joint issues. That is orthopedics, musculoskeletal issues, and if you're having any kind of pain we call chronic pain 90 days or more, then you want to stay tuned because Dr. Darrow has miraculous things to tell you.
I don't know about miraculous, but that's nice of you. At any rate, my entire medical career has been in the field of regenerative medicine, which involves today injecting stem cells or platelets, PRP, which is platelet-rich plasma. Very simple procedures where patients walk into the office. Who's tapping their teeth, Nita? They walk into the office, they get an injection of these cells, and they can walk out. They don't need anyone to drive them. They don't need anesthesia. Very, very simple. And what it does is it stimulates new tissue to grow. So if you have any kind of a symptom with pain in the musculoskeletal system, that means your tendons, your ligaments, your joints, muscles, you name it. These are things that generally we can help heal. And the really cool thing about it is we don't use knives to do it. We stay away from surgery. I can't remember the last time I referred someone to a surgeon who has come in. However, many, many, many people come in ready for a surgery, and then a friend of theirs will say, please don't do that. Come in to see Dr. Grove, that's Thomas Grove, who's my associate, or myself, Marc Darrow, and see if they can help you heal the area without a surgery. We'd like to stay away from surgery if possible, because surgery is very invasive, and we see way too many people who come in after what we call a failed surgery. That means they had a surgery, it was supposed to make them better, but what happened? They either didn't get better or they got worse. And if you look at, not that you folks will do that, but those of you that have had failed back surgeries, you know the answer to that, because there's an actual diagnostic code in the insurance companies, which means that there's lots of it's going on. That means if you have a failed back syndrome, that means the insurance companies are already prepared, because there's so many people that have had failed back surgeries, meaning they had a back surgery that came out worse. So that's everywhere in the body. It's not just the back. We know that back surgeries, and all you folks know people have had back surgery, neck surgeries that didn't work out. I mean, it's just that common. Now, I have to mention here, I am not blaming surgeons for this. I love surgeons. And the reason I love surgeons is because I was on a surgical track in medical school, and I wanted to be a surgeon. And in internship also, I was thinking about it. And I love doing the surgeries. Orthopedic surgery, to me, is a lot of fun. And I don't mean fun in a way that's ha-ha. It's just a highly technical field. It's very sports-oriented, and we get a lot of sports figures that have it. So it was a lot of fun for me doing it. I was never the lead surgeon. I was always backup in my training. But after a shoulder surgery on my right shoulder, because I didn't know any better at the time, from a weightlifting injury, I had a surgery and it came out bad. It failed. I had a failed shoulder surgery. So I loved my surgeon. He was my boss. He was my professor. And I never blamed him for it. It's just kind of what happens sometimes. And the kind of sometimes is very, very prevalent. My office is filled with failed surgeries. So what we do instead are very conservative procedures, which are injections. It's called percutaneous. It means through the skin with a needle. And all we do is we inject your platelets or your stem cells into the area. The platelets we'll use for lesser type injuries or syndromes. If you have something like an advanced arthritis, PRP can be helpful, but you'd want to use that with stem cells. We get better bang for your buck, you might say, using stem cells. It's more powerful. There's better tissue growth. There's studies that we've seen on that. So if you would like to come into the office, I'm going to give out the phone number to the office, and you get a free phone consult with my staff. Now, a woman called up a few days ago very angry, saying that I say on the radio that people get a free consult with me. I have never said that. It is not true. I wish I had the time to give free consults to everybody. I just don't. And Dr. Thomas Grove, who is the injector today, does not. So you call up, you get a free consult with my staff, just to clarify that. And the phone number to the office, if you want to call right now, there are people there, is 800-300-9300. That's 800-300-9300. You can call day or night, and we'll get right back to you if the phones are busy or someone's not there. And if you want to talk to me live right now, I will give you a free phone consult, but only on the radio. And the phone number to the radio right now in the studio is 866-870-5752. That's 866-870-5752. And for those of you that don't have time to listen right now, and you want to hear the show and probably a few years worth of shows, which is cool because we talk to a lot of different people. It's a call-in show at 866-870-5752. You can watch these videos because I take all the videos. They're on camera right now, and I'm on camera, and I put them onto our website, which is www.jointrehab.com. So you can go to the website, that's www.jointrehab.com, and you can actually watch my live radio shows there. And you can also watch videos of me doing these procedures of PRP, platelet-rich plasma, or stem cells. So you can watch and see if you think it's something you'd rather do than surgery. I can't tell you the number of thousands of people who have come in a day or days or weeks before a scheduled surgery who have canceled their surgery to do our procedures, and we've gotten them better without surgery. Now, as much as I loved doing surgeries back in the day in my training, I have to just say I don't think it's a great idea anymore. Since I learned about regenerative medicine and platelets and stem cells, I've seen people heal. Nita said the word miraculously. I don't like to use that in medicine, but to some people it's a miracle, because if you have pain and you get a simple injection and you heal, it seems very miraculous. To me, it seems miraculous, but I'm not going to say it's a miracle because it isn't. It just makes sense. All we're using are cells that stimulate the body to repair itself. Okay, it's not a miracle. It feels like a miracle if you get better.
It does, because they come out of pain. That's why I say that.
And you say they, but it's you and me too, Nita.
Yeah.
We both had the procedures done.
Well,
and
yes,
gotten
but
better.
I mean, I'm focusing on our listeners because I want them to feel included. I mean, you have done this show 25 years. I've done it with you 14 years. And by now, I think the audience knows you care about every single person listening. And we want them to be out of their chronic pain.
Well, that's true. And as far as the caring goes, Dr. Grove, who's doing the injections now, and I both have our cell numbers available to every patient. Anytime someone walks in the office, we have our cards sitting there. We tell them, please call us if you have an issue. If you have an issue, you're nervous, whatever it is, call us. You can call me at 3 in the morning. I'll be asleep. I'm not going to pick up the phone. I turn my phone off. But as soon as I wake up, I check for messages. I check for text. That's the first thing I do when I wake up, and I respond immediately. And during the day, we pick up, and whenever it's possible, we pick up. We do care about our patients. Dr. Grove is very similar to me, very, very similar in all ways. He's been working in the field for about a dozen years. I've been doing this for over 25 years. And I think the show has been about 22 years because that's when my twins are born, and I started doing it around then. But needless to say, it's amazing.
That's pretty exciting.
It is. So, Nita, I'm going to give out the phone number right now to call us and talk to us live. And the phone number to the studio is 866-870-5752. That's 866-870-5752. And if you want to call the office and get a free phone consult with my staff, because it won't be with me, that's 800-300-9300. But if you call now to the radio, you'll get, a free consult with me. I'm not sure what it's going to be worth because I need to do an examination to really, or Dr. Grove is the same way, or use the ultrasound. We use an ultrasound to look inside the body. And it's also a great way to guide needles. If you're getting injections with regenerative medicine of platelets and stem cells without an ultrasound, that doctor has not been trained well. So both Dr. Grove and I have been trained for years and years and years on ultrasound, and it's an amazing procedure. It's simple. You just we have 3 ultrasounds in the office. They're on little wheelable carts, and we rush them from room to room, and you just turn it on, put the probe on the body, look inside and see what's going on. And then for injections, you can actually watch where the needle is going to. There are studies that show that if someone is injecting, if a doctor is injecting, let's say your knee, blindly, we call it blind if we don't have an ultrasound to look, they are going to miss the area they are looking for 1/3 of the time. So be careful, be smart. Get a doctor who uses ultrasound. Also, if you're going to do these procedures, get a doctor that does this all day long, every day of his life. Don't go to a chiropractor and by the way, I like chiropractors. If I have some kind of injury, I might try a chiropractor before I inject myself. Yes, I have injected both my shoulders, my knees, my elbows, my wrist. I've had other people inject my neck and back and all my ribs because I can't reach back there. I tried in the mirror. It's dangerous. But all the parts of my body on the front of me, I can inject. It's very, very simple for me because I could do it blindfolded with one hand behind my back. I've done so many of these. And
You could do it in your sleep.
Wow, that's an idea. Now I'll probably dream about that.
We should try that.
Yeah, absolutely. So anyway, give us a call at the studio live right now. Ask me any questions about musculoskeletal orthopedic medicine. I'd be happy to answer anything about your issues. And the phone number here right now is 866-870-5752. So, Nita, if it doesn't bother you, I'm going to go to... actually, I think I'll do this. I'm just going to hit you with one joke, Nita. You ready?
Sure.
Okay, this is so funny. Why are peppers the best at archery?
Because they leave the salt at home.
Well, that may be true, but they may have salt. So why are peppers the best at archery? Because they habanero.
Oh, I never would have got that.
No, that's kind of a hard one.
That's okay. So
How do you tell the difference between a bull and a cow, Nita?
okay, I didn't hear that whole question. A bowl what?
How do you tell the difference between a bull and a cow?
A bowl and a cow. Oh, a bull and a cow.
There you go.
Okay, I thought you meant bowl like cereal bowl. I couldn't get that.
Now you're making me hungry. It's either one or the other.
Oh, okay. Well, if you're hungry, just like I have a lot of snacks here today for the team.
Smart.
I wouldn't say they're all so healthy, but
Well, you got to live it up.
I got gluten-free muffins. That's pretty good, right?
It is good. But you know what? Gluten-free does not mean carbohydrate-free,
That's
which
true.
is funny. A lot of people go, I'm on a diet, I'm on gluten-free. I'm trying to lose weight. Well, that doesn't help you lose weight.
No, it just helps the digestive system if you have that sensitivity.
That's
But
true.
speaking of sensitivity, it's very tough to be in chronic musculoskeletal or orthopedic pain. Chronic pain, as we said earlier, is pain you've had 90 days or more. And, a lot of our people call it, and they've had pain 10, 20, 30 years, Dr. Darrow. It's
I know.
very
It doesn't
upsetting
make
to me.
sense while they're not trying something new. And when I say new, it's not new to me. I've been doing it over 25 years, regenerative medicine. And it's been around since the late 1800s. So why isn't it done more? I'm not going to get into the medical industrial complex because I don't want to talk politically. But if you call me up or you email me about it, I'll talk to you about it. I'm going to go to a question here. It says fourth lumbar surgery.
Okay.
Ooh,
Ouch.
that's pretty crazy. It amazes me. People come in with not one, not two, not three, and sometimes not four, but they have 5 surgeries on the same area. And I'm like, when are you going to get it? All right, so this one says, I'm a 53-year-old male. I've had a fusion. Oh, by the way, if you go to my website, www.jointrehab.com, that's jointrehab.com, there's a spot on every page to email me, and that's where these questions are coming from. So this patient, or not this patient, but this looker wrote this question through my website. It says, I am a 53-year-old male. I've had a fusion at L5S1 in 2001, another at L45 in 2005 or so. I found out it failed about 16 months later and had it redone. Whew. That one took. Took means the fusion looks good. And by the way, I did a study on back fusions when I was in medical school, and guess what I found?
What?
Most of the fusions failed at some point.
Oh, dear. That's not good.
Even fusions that were done with metal. Okay? So that one took. Well, we'll see how long it takes for, right? I don't know why, but I started walking noticeably stooped forward at the waist, and it got more pronounced as time passed. Now, this is a guy who's 53, so that's a real problem. Last month in January, had my old hardware removed and new rods installed, and it realigned my spine from L3 to S1, and I now no longer have an advanced stoop. I stand up straight now. When I woke up from surgery, I was screaming because it felt as if my hips and ribs were being ripped out of my frame.
Ouch.
Ouch. I take 2 buprenorphine, naloxone, twice a day for pain at the Veterans Administration. My surgeon has cut me back to 1.5 oxycodone every 3 to 4 hours and cyclobenzaprine. Wow, this is a lot of medicine. I had 32 staples removed day 2. No, sorry, this is a month later. My hip, groin, left knee pain has me in tears daily, and at post-op was informed we'll begin aggressive physical therapy soon. Will stem cell or PRP be an option, being this is my 4th lumbar surgery? My neck is being scheduled for the same procedure soon. So, I worked at the Veterans Administration on and off for 3 years during my residency at UCLA. That's one of the hospitals that we worked at. And I'm not going to put down the VA because it's a place, where veterans can go who don't have insurance, right? So it's a great thing. But it's a teaching hospital, and most of the surgeries being done there are being done by doctors in training. Okay? Now, these are major surgeries that this poor man had. He's had 4 major surgeries done by a doctor in training. Is that something that anyone out there would want to do? Not me. I've had some surgeries, but when I do, like I had a cardiac ablation back in October, I went to the best guy in the city. I spent a few weeks, inquisiting different doctors and finding out who does the most. Okay? And for those of you who need a cardiac ablation, if you have atrial fibrillation, there's good guys at Cedars, at UCLA, at St. John's, guys who do these all day long. And those are the kind of guys that I go to. I don't go to the VA to get a procedure done like this. Hopefully I'll never have this kind of procedures. But the big question here that the person has, I hope you're listening to the show, is that it is possible for PRP and or stem cells to help get rid of the pain you have even after 4 surgeries. How can that possibly be? Why would they want to do another surgery if they could do injections? Because they don't use their hands to do an examination to find out where the pain is coming from. This person may not have needed that first fusion. I hope this is setting into you folks. If you're not being examined and the doctor's not finding out where the pain is coming from and you're having a surgery, you're having a problem because you can't. Well, you can do a surgery based on an MRI or an X-ray, but does that mean that that X-ray or MRI is showing where your pain is coming from? Absolutely not. There are endless studies, and by the way, for those of you that call in right now at 866-870-5752 to call me, you get a free copy of my book, which is Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's a 200-page book. There's, 250 studies, scientific studies, showing how platelets and stem cells work and how surgeries fail and how MRIs or X-rays do not show you where the pain is coming from. So that's a real problem in medicine today. Hang with us. We're going to a break, and we'll be right back. And I'd love to get your calls. Call us at 866-870-5752 or call my office at 800-300-9300 where you can get a free phone consult from my staff, not me.
Perfect. And we'll be right back after this.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.